Despite the increases in COVID-19 cases locally, former Chief Medical Officer Dr. Patrick Martin is not too alarmed. In fact, he believes the numbers may have already peaked based on the current trend.
But usually a surge goes for 6 to 8 weeks. That's the usual pattern in epidemiology, 6 to 8 weeks. I would say by the end of the first week in September, second week, will give us a better indication as to whether we did see the peak last week.
The rate of increases of COVID cases is among the highest in recent times since the second wave outbreak in mid-May this year. Between Wednesday and Saturday last week, the Federation recorded 109 new COVID-19 cases. There are over 540 active COVID-19 cases in the country. Chief Medical Officer Dr. Hazel Laws, in a recent press conference, said persons who are vaccinated and who may have contracted COVID have mild symptoms and recover quickly.
Were mainly without symptoms, and they were none of them were admitted to the hospital. And they recovered quite quickly, because what we are seeing or realizing is that once you are fully vaccinated, diagnosed with COVID, we can test you like in 7 days and we get the first negative. So you recover quickly. So that's our experience. The unvaccinated is taking round about 12, 14 days or more to recover from the disease.
With increasing cases, some persons are wondering what measures the government will be taking, whether to have a complete lockdown to reduce the cases or partial curfew. But Dr. Martin is not in favor of a total lockdown. He believes a lockdown will do more harm than good.
I support the view espoused by the Singapore foreign minister since March last year that health and the economy are on the same side of the coin. They're not on opposite sides. We have to consider both simultaneously. I don't think it is fair to say that persons who are seeking to keep the economy afloat have no regard for human life. And I know you didn't say that, but I don't think that is the issue at all. Because a weak or poor economy is a threat to life, definitely a threat to mental health. And people can sink into such deep despondency as to take their own lives. Definitely, we have seen the rise in family-based violence. We have to put all those things on the table and try to strike the correct balance. You know, there are times, if things are really approaching catastrophe, sure, the lockdown measures will gain more currency. But at this stage in the pandemic, it's about living with COVID.
The Health Promotion Unit disclosed a fifth COVID-19 death on Saturday. Andre Huey, SKN Newsline.